Hello, my name is Sarah Malinka and I will be doing my presentation for you today on medial tibia stress syndrome. So what is medial tibia stress syndrome? It's a long word, but it's also shortly known as shin splints. Medically defined, medial tibia stress syndrome is pain along the front side of your lower leg focusing on the bone. It is caused by repetitive stress of the bone and the connective tissue that attaches your muscle to the bone. So it's kind of like, I've been explained that it is like a pulling of your muscle from your connective tissue. So it's kind of a pulling of your muscle away from your bone. So that's where that pain kind of comes from. It is as well as soft tissue inflammation from an increase of activity without allowing the muscle to adapt in time. It affects any type of athlete, specifically on runners, and basically anybody you see walking down the street. They'll be like, if you ask them, they'll be like, yeah, I've had shin splints, or yeah, I have them right now. It's just like a pain on the front of your shin, and you can get it from dancing a night at the bar in your high heels, or walking up a hill like when you're walking to class or something. So they're very, very common and lots of people get them. So next I'll be talking about the different types of shin pain. There are 3 of them that I'll be specifically talking about. The first one is compartment syndrome. First of all, I'll say all of us have learned about fascia. So the fascia of anywhere in our body, but we're going to be focusing on the fascia of the lower legs. So this fascia of the lower legs expands when your muscle expands. So your muscle expands when you work out because of oxygen and blood flow and everything's going to your muscle, so it kind of expands a little bit. So there's an intense extreme pressure buildup. So that pressure buildup is the muscle expanding, but the fascia is not. That's where that pressure comes, and that's where that pain comes from. So it mostly affects athletes like soccer players and runners, but the type of pain that you'll get from compartment syndrome is kind of like shin splints. So you'll get like that, your bone will hurt and you'll have like an achiness and a weakness and a numbness. The next one is medial tibia stress syndrome. So like I talked about above, it is basically just the irritation on the shin bone and soft tissue around it. So the pain is directly on the bone though. So you can see the pains on the bone there. What we'll be focusing on is a stress fracture, and it starts with the same symptoms of shin splints. So except for this pain, it occurs during and after activity as well, and it continues on. So the pain doesn't really go away while you keep on having stress on that bone. So in conclusion, it would probably be pretty hard for a doctor to diagnose which 3 without knowing really anything more besides like the symptoms of the shin splints, because all 3 of them have the exact same type of pain when it first starts out. So quiz time, just to make sure you guys are listening. What injury out of those 3 diagnosed do you think is the most rare and severe? If you guess compartment syndrome, then you're correct. Compartment syndrome is extremely hard to diagnose, and it can be very severe if it's not found quickly. So my next point is, how do you tell the difference between the 3? All of them kind of sound the same. All of their symptoms are the same. They all focus on the lower legs. So how do doctors know which one's severe and which one you can tolerate and you can manage? So again, we'll first start out with compartment syndrome. So compartment syndrome, it's also known as chronic exertional compartment syndrome, CECS. So this is kind of the not as intense one. There's chronic and there's acute. So acute is when like you need to go to the doctor right now, and acute's kind of the one that you like see on Grey's Anatomy, and they're like, gotta rule out compartment syndrome because it's like a trauma, and it's when the muscle swells really fast, but that fascia doesn't have time to swell it up. So that's why they say compartment syndrome. How do you diagnose compartment syndrome? So really, if there's nothing that gets shown up on x-rays or bone scans or any type of imaging, and you still have this intense pain and you can't walk, and you're just like you have this shin pain, but you don't have shin splints, you don't have a stress fracture, like what is it? Or how do they figure out that it's compartment syndrome? So the test that they do for compartment syndrome is called a pressure test. So I'll explain that they take 18 gauge needles. These are the excuse me. These are the needles that I actually use back home on the farm on my cattle when we are processing cattle and we need to give them any type of medication. We use 18 gauge needles. So they go on the lateral and the medial side of your lower leg, and they insert in 3 different spots on the sides of your legs. Find those spots and they read the pressure. So they go 3 or 4 on both sides, and then they find those pressures. Then you go and you run for as long as you can, and then you come back to the table and they do the same test, and they do this exact same spots to try and find those pressures again. If the pressures have jumped sky high, then that usually means that there is something wrong with the fascia that isn't expanding, and you most likely have compartment syndrome. The only way to really treat compartment syndrome is by doing a surgery. So people often do the pressure testing again after a couple months, maybe make sure it's severe, but it's not acute. So this CECS, it's severe, it's not acute though, so you don't need surgery immediately. Again, maybe don't quote me on that, but this is the stuff that I have found. If CECS is not found and they're not managing it and not maintaining it, then it can become something worse if you're going on with your daily life and you have this pain and you're just pushing through it. So the surgery that gets done to help with the compartment syndrome is called a fasciotomy. So a fasciotomy is when, again, they go in on the medial and the lateral side of your lower leg, and they'll do an incision and they'll release that fascia. So they'll cut that fascia. So then when you do exercise and when you walk and when you do whatever, that muscle in your leg will then be able to expand and they won't have that pain. So the next is stress fracture again. So first you'll go to the doctor and you'll be like, oh, I have shin pain. And they'll be like, oh, you have shin splints. And then you'll be like, no, it's right here. I can point it out. This is what it is. And they'll be like, okay, so possibly a stress fracture. We'll send you for an x-ray. So you go and you get your x-ray and then you come back and it does show something, but it's not exactly identified for right there. That's where that stress fracture is. So most likely they'll send you for a bone scan, and that will show you exactly where that stress fracture is. So then you can start your healing process right away. The only really way to heal a stress fracture is kind of just rest. Takes about 4 to 6 months depending on how severe it is and if you caught it in time and stuff. But rest is basically the only way that stress fracture will go away. So we have another quiz. Between the 2 scans, which do you think is from an x-ray and which do you think is from a bone scan to find a stress fracture? So we have the 2 scans. This one you can obviously see right there that there is a black dot. The next one is zoomed in, so it started here and then it continued to get zoomed in, so then you can see that there's a little crack in the bone right there. If you guess that the left scan is from the bone scan, then you're correct. So the left is a bone scan, the right is an x-ray, and as you can see, the bone scan, if we go back, it shows a very, very clear picture of what that stress fracture is and exactly where it is. Where the x-ray, they kind of had to zoom in a little bit. It's there, but it's not as clear. So maybe you were right, maybe not. The next point, and my last point, is how do you get rid of shin splints? So after reading many articles, I've come up with a list. So just icing, aspirin, stretching. You could potentially go on a walking boot if it gets that bad. You could do some type of strength exercises, some compression socks and stockings. Just plain old rest, and it's not really one way to get rid of shin splints. Everybody reacts to shin splints differently, and everybody will have that one thing that, yeah, this kind of works. Maybe I just wear comfortable shoes today. Maybe I don't go out in my high heels kind of thing. We all have that one pair of shoes that instantly you can feel, oh, I got those shin splints back, but then they go away the next day. So just keep in mind that there are different things that come from the pain. Diagnosis, sorry. So my last question is, which cure do you think is the most successful? If you guessed rest, then that's correct. If weight is not repetitively on the bone and that stress isn't there, then the healing will then your bone will be able to heal and that inflammation will be able to settle down. So I'm sure most of you are thinking, why would I want to do a presentation on shin splints and compartment syndrome and stress fractures? Well, I was actually, I experienced compartment syndrome and I experienced a stress fracture and I've experienced shin splints. And I've experienced the fact of having that pain and them not knowing and then it becoming compartment syndrome. So that's why I did my presentation on this, and that's why I'm so strongly for knowing what your pain is and knowing what you possibly could have. I went through the fasciotomy. So the fasciotomy I have done on both of my lower legs, and I actually acquired an infection from the fasciotomy. It killed 30% of my muscle. I was in the stollery for a month, and I had I think I had 9 surgeries in the end, and I actually ended up with a big scar on my lower leg. It to this day still affects me. That muscle is obviously still gone, and I still have a lot of problems with my lower legs. This is my end scar, if you can see. And then if you're not good with pictures, this is what my leg was during the infection. So it really affected me, and that's why I did my presentation on it. So thank you, and I hope you guys learned something.